Alright guys, we're going to be talking about Haemophilus influenza type B. Haemophilus influenza type B is the cause of a wide range of diseases. It's also known as HIV. It's a bacterial infection caused by Haemophilus influenza. This infection can have different symptoms depending on what part of the body is being affected. Some types include meningitis, glotitis, pneumonia, arthritis, cellulitis. The disease was discovered in 1892 during an influenza outbreak. Back then, scientists thought the HIV was the cause of the flu. Because of this, they named it Haemophilus influenza. Later, scientists would come to recognize that the flu is caused by a virus, not this bacteria. Despite this fact, the name influenza was kept.
So this disease can affect any person, but there are a few groups that are at higher risk. The groups at a higher risk of getting this disease is children under the age of 5, and that is because most of those are not vaccinated yet because they're not old enough to be vaccinated. Adults over the age of 65 and any children that are not vaccinated are going to be all at higher risk to get this disease. Additional groups that are at higher risk are people with certain medical conditions that include sickle cell disease, people that have no spleen, HIV, and a few other chemotherapy or radiation therapies, because none of these people are eligible to be vaccinated. So therefore they're going to be at a higher risk of getting this disease. So this graph kind of just shows the amount of people across the age group that get the disease. So it's, as you can see, more commonly affected the younger and the elderly. The elderly and the younger are more vulnerable because their immune systems aren't able to fight these infections because either they're too young to get the vaccination or they are too old to get the vaccination. So as you can see, the vaccination was developed in the mid-1980s, and as soon as it was developed, it dropped dramatically. In fact, the incidence of the disease has declined more than 99% compared to before the vaccination, as this slide is kind of showing us. So from the years 2003 to 2010, an average of 2,562 HIV infections were reported per year to the CDC. Of these, approximately 16% were kids younger than 5 years of age, and 33% of those children were younger than the 5 years of age because they didn't have the vaccination. 67 of the confirmed cases of HIV were 6 months or older and were eligible to receive the vaccine, but 64% did not receive the vaccine, and that's why they contracted the disease.
So HIV is transmitted in two different ways. First off, through aerosol droplets. That's when someone sneezes or coughs or spreads water through their lungs, and the other person contracts it by breathing it in. Basically, that enters the cell and multiplies inside the body. Next is skin-to-skin contact. When someone touches mucus, coughs into their hand, or sneezes onto their hand, touches another person, and that next person kind of touches their eyes, ears, or nose. It can also be transmitted through a fomite, which is like a non-living vector. And so that's like a toy, doorknob, pencil, things like that. So then the next person kind of touches their eyeballs and the virus is spread that way.
So the clinical manifestations of this disease really depend on which part of the body is affected, kind of depends on that transmission. The most common and severe types of this disease result in kind of pneumonia, bloodstream infections, and meningitis. And overall, the symptoms are fever, chills, cough, shortness of breath, nausea, vomiting, diarrhea, tiredness, sweating, altered mental status. With meningitis, there's a chance of phototopia or sensitivity to light and a stiffened neck.
So for prevention, the biggest prevention strategy is the HIV vaccine. This vaccine is strictly used for type B. There's no vaccine for other strains. People that are in close contact with the patient may need antibiotics to prevent them from getting the disease. This vaccine prevents against meningitis, pneumonia, and other types of infection. It's recommended for all children younger than 5. The first administration is usually around 2 months of age. The way the scheduling works is the first dose, like I said, is at 2 months old. The second dose is at 4 months old. The third and fourth, also called the booster doses, are between 12 and 15 months of age. 9 months old and 18 months to 4 years old are recommended gaps for the catch-up doses for the vaccine.
Alright, so prognosis. Most individuals that are diagnosed with Haemophilus and influenza type B or HIV will reach a full recovery. According to the CDC's Haemophilus influenza disease article, even when patients are given antibiotic treatment, 3 to 6% of all children with HIV will die from the disease. Up to 20% have permanent hearing loss or other long-term neurological issues. Older adults, due to their decreased immune system, have a higher fatality rate. So the disease is treated with antibiotics, and this usually lasts about 10 days. It often begins with an IV third-generation cephalosporin. With HIV meningitis, cefotaxime and ceftriaxone are the drugs most commonly started. Ampicillin shouldn't be used, and this is because at least half of the strains are resistant to ampicillin. For children with HIV meningitis, dexamethasone is a very imperative drug to take, and this is because it decreases the inflammatory response and the rate of hearing loss as well. And this medication should be given for 2 to 4 days. When the bacteria invade parts of the body that are normally free from germs, the patient often requires hospitalization. For those individuals who are close to the patient before they were admitted to the hospital, they may require prophylactic therapy. If they do, rifampin is used most often. The nurse plays a critical role in caring for a patient with HIV. Interventions that the nurse performs include the following, but are not limited to the following: obtaining culture specimens, administering proper medication, providing emotional support to family and the patient themselves, maintaining droplet and contact precautions, administering prophylactic treatment to individuals in contact with patients that are not vaccinated, and discussing vaccination against HIV. The nurse should also make sure the patient is comfortable and that the parents of children that have HIV are informed of the disease and of all the care the patient is receiving and needs. Depending on where the bacteria travels to in the body and causes infection, complications include brain damage, hearing loss, bacteremia, and actually the bacteremia can result in the loss of a limb or limbs, and death. Other serious complications include permanent neurological disability and mental retardation. In most cases, though, complications aren't very severe and they're usually rare.
Okie dokie.
Okay, so this video is just a demonstration to show how vaccines work against this disease. This vaccine for this disease is very important because if you don't have the vaccine, it's almost the only reason why you'll get this disease. So in order to demonstrate this, we have John, who is giving the vaccine to Anna and Luke over here. So go ahead and give them the vaccine. And this is Jeremy over here, and he is unvaccinated. So we're going to just see how this works out. So they are vaccinated. And we have Jeremy over here that's not. So John, if you want to help me over here. So we have these pieces of paper that are are like the disease. So I'm going to try to throw this disease at them. It's not going to work. John, why don't you start your disease? As you can see, the vaccination is going to keep them from getting sick. But Jeremy is not so lucky. So this is just a demonstration to show the importance of vaccinations and why we should be encouraging them.
Get vaccinated.